So almost a year ago now, I gave a talk entitled Gender Bound: Lessons from the World Between. In preparing for that talk, I engaged with some intersex activists who provided extraordinary insights that helped me to craft that into the message it needed to be. I sent the transcript to those activists, and one returned feedback that fundamentally changed my understanding of my role as I strive to contribute to creating a more socially just world. That feedback was this: I didn't expect you to listen with care, but you did, and I was relieved. Thank you for that. I was sort of stopped in my tracks. Listen with care. I was relieved. People who live on the margins of influence are so accustomed to not being heard that when somebody takes the time to listen with care, it's relieving, it's a relief, and they're grateful. Listening, authentic, deep, listening with care is a powerful act of love. That same civil rights activist, that same intersex activist, sent me some more feedback I'd like to read. This is what the message said. I did not anticipate your explicit and emphatic statement regarding it being time to stop cutting the genitals of children. When most people would rather discuss gender in all its plasticity, you chose to address the meat of the matter. Most importantly, you did not shy away from the substantial human rights, human rights elephant in the room. It is only 2 days ago that the truth that those words were meant to speak to me became obvious. I realized that I have a privilege that I didn't even realize I have. I'm a physician, and in our culture, physicians are granted virtually unlimited authority to decide, to decide what is normal and what is abnormal about the human body. That's a lot of power and a lot of responsibility. It is not always power that is executed with extraordinary responsibility. That understanding that privilege, it means that when I talk about something, if I am granted this privilege, then my voice is amplified over potentially drowning out the voices of non-physician intersex activists or other activists. When I prepared that talk, I had a choice to make, one or two pathways that I could walk down in crafting that message. And I'm not even sure when I started doing that I realized that. It was through the process of listening with care, listening to the intersex activists who had lived experiences that informed what I needed to say, not what I needed to say, but what needed to be said, that I chose the pathway I chose. The first way that I could have crafted that message would be to use the stories of people who are born with intersex traits to have a theoretical conversation about gender and sex. That would have been safe, and that is, I will say it very clearly, that would have been a human rights violation. The second pathway is to use those stories, put an unflinching stake in the ground, and make it clear that human rights violations are ongoing and have to stop. So often, when we're not listening with care, we don't do what needs to be done, but we do what we need to have done. One of the options that is often exercised is to use those stories to create spectacle, to fetishize or stigmatize people born with intersex traits. And that is in and of itself a problem, but it's a bigger problem than just giving the wrong message. it's when you think about the privilege of garnering the spotlight, if I were to have done that, I would have pulled the light away from the voices that are out there just working to be respected and given human dignity. So an analogy that I came up with a friend was, it is like those who are on the margins of influence are songbirds. And in this world, there's this incredible rock concert. If we contribute to the noise, nobody can hear that songbird. So responsibly, part of our responsibility is to listen with care and then act in a way that lets the songbird be heard. Because I did that, I evolved my message the way it should, and listening allowed me to understand the truth. It was my own personal truth, and that's what happens when we listen with care, because that's a reflective listening. We sometimes, as we think we're giving of ourselves so much to listen to someone else. If we really listen, we realize that that reflects back on us, and we hear our own truth as we are seeking to give space to hear the truth of another. My truth is this. My job as someone with privilege, as someone who seeks to create a more, or contribute to creating a more socially just world, is to make space for those who have a message and are not given a voice. And that's a new insight for me in the last couple of days. Let me talk about intersex for a couple of minutes. Intersex occurs, those are people are born with intersex traits 1 in every 2,000 births. That's about as common as redheads, so it's not rare. What that means is that they are born with physical sex characteristics that do not meet the cultural expectation of what is typical. That can be genetic, it can be hormonal, it can be anatomic. Most people born with intersex traits are healthy, and the difference that they have in their body from what culture expects their body to be like is harmless. And yet in 2015, adults who are uncomfortable, parents, doctors, caregivers, they allow their discomfort, I'm going to set this down here, their discomfort to push infants and children into cosmetic genital surgical procedures so that their genitals are reconfigured to conform to what someone's idea is of what their genitals must look like in order to thrive in a world with a rigid binary. The problem is that rigid binary does not align with the natural world. That is a social construct. So stop and think about that for just a minute. We are doing irreversible surgical procedures on infants and children so that we adults are more comfortable. And we are missing the opportunity to teach children and their peers to accept and celebrate differences. Sort of like 2 hits. It's time that we stop that. Now, I've been delighted and surprised with the number and the variety of people who have watched this gender-bound talk and who have expressed that it was of importance to them. One of the people in particular that I've had conversations with is a cousin of mine. I have lots of cousins. This cousin is a devout follower of the Christian faith. And so the conversations that we have had have been through the context of that faith. And the conversations we've had about Jesus have resonated with me and sort of stayed in my thinking while I've explored the topic of listening with care. The stories that describe Jesus' interaction and communion with communities are notable for a theme that emerges over and over again. That theme is presence. And when I say presence, what I mean is when we are present, we are in the moment, we are without an agenda. We are without a judgment. We're not shaking our finger at somebody. We are there to be and to open space for those who need to be heard to be heard. Jesus used presence to empower people. That was an act of love, an act of validation. There was no judgment in that. The discussions that we had, they led me to this question. What if, in walking on the earth, in practicing what he preached about love, in being present and opening space for those who needed to be heard, what if Jesus was bringing a model forward of how we treat humanity, of how we listen with care? One of the questions that comes up is, if we are to honor our own personal truth while at the same time honoring the truth of others, what if those are mutually exclusive? I mean, that's a problem. I started sharing this gender-bound talk in January. And since that time, a number of people who are, like my cousin, are devout followers of the Christian faith, have shared with me that prior to seeing the video, they experienced a conflict, an internal conflict that they couldn't reconcile. On one hand, there's, for some faiths, the mandate, the requirement to reject people or the acts of people who are members of the sexual minority community. But on the other hand, there's a true belief that love thy neighbor is the right thing to do. What I've been hearing, though, is that for those individuals who have dared to open space and listen with care to the information that was available in this video, it has provided insights that allow them to reconcile that conflict. It allows them to align with the requirement, the sort of the spiritual mandate that we stay true to ourselves spiritually, but also to honor the natural truths of others. How do we make that happen? In this congregation, how do we create listening, a listening space that can build bridges of understanding and help to bring this world toward a greater level of social justice? Well, the first thing you have to do is commit. 2 weeks ago, there was a service that was entitled Confronting the Comfortable Silence. It was the first time I felt confident that this was not just a social club. I mean, I'm new here. That this was a place where there was serious intent and commitment to make a difference in this world. And I commend you for that. One of the worship leaders said, part of ministry is radical, intentional hospitality. I love that. Then that worship leader gave a list of things that this congregation could do that only cost being mindful of the needs of those who have differences. I would add, listening with care should go on that list. It's not a trivial skill. There are ways to learn it. Each one of you, I hope, if you didn't receive this, they were passing these out at the beginning, or out by the order of service. This is a brief guidelines for intersex allies. There are a lot of tools and resources in here for learning to listen with care. I encourage you to read it and share it. During the lead up to this service, a question came up that has me pondering a number of things, and I've pondered this for the question probably came up 2 weeks ago. Here was the question, and I hope it's okay that I say this. Somebody asked me, is Anunnaki going to come out at the service? I didn't ask. But I really, really felt uncomfortable with the question, and I tried to explore why it is that that question made me squirmy. And the reason is this. I think it's backward. I would assert that when no one must hide a secret in order to feel unconditionally welcomed here, then and only then will this church have fully, truly, without reservations, come out as a radical, intentional provider of hospitality. And with that, I'm going to say our first moment to practice this is right now, and it is my honor to ask Anunnaki to share with us his personal truth. And I would invite all of you to listen reflectively and listen with care. And in listening, don't be surprised if what you hear is partly your own personal truth. Thank you very much for taking the time to listen. Yeah.
Good morning. This is the first time I've ever talked up here, so God help me. I'm honored to be speaking with you guys today. My name is Anunnaki, as you guys now know. And like many of you, I'm a parent, I'm a spouse, and I'm privileged to enjoy a wonderful family. I've been with James for 27 years. We are proud about this. Some of you have met my husband and my kids. We're pretty amazing. I love my kids very much, and my family absolutely means the world to me. I don't know what I'd do without them. I really appreciate your listening to my piano composition. I wrote that over 30 years ago, and a lot of my gifts vanished, and recently they are reemerging. So it meant much for me to be able to share that. I wrote that piece before the mandates of cultural conformity fractured my connection with myself, the musician, and myself, the artist. And I'll tell you more about that and my pathway to my current work as a social activist in a few minutes. But first, let me tell you why I'm here. Judi learned about my work as a social activist and asked me if I'd be willing to share some of my story today, and I said yes. I was born in 1967 in a pretty traditional way. I was born, I was inspected, certified to be a girl, labeled with the girl's name, that culturally sealed the deal, and there I was, a female. But my story is a bit different. I was born with intersex traits. That means that I was born with physical characteristics that don't meet typical expectations of male or female. People with intersex variations have genetic, hormonal, and anatomical features that do not fit what is typical. In my case, it was hormones and an anatomy that did not conform to expectations for a typical girl or a typical boy. In addition to being born with intersex traits, I was born with two genetic defects, one that causes Ehlers-Danlos syndrome, and that is a condition that involves all the connective tissue in my body, and the other is known as mitochondrial dysfunction. And the mitochondria are the powerhouse of each and every one of your cells. So they produce energy. And so when they don't work right, it can affect every aspect of your body. And to cap that off, my neurological differences placed me on the autism spectrum. I remember myself at the age of 3 and 4. I was a little boy going up to Children's Hospital each week, where it was their job for therapists to teach me that I was a girl. I had been pushed into the female box at birth, so anything I had to show the world or say was absolutely disregarded. Back then, they called this problem perception handicaps and a reversal problem. With anatomically correct dolls, they taught me I was female. I have learned real fast what made a good girl and what made a bad girl. Kids are really smart. To be good, I had to deny my true self and comply with the rules that they had given me. Years later, I obtained my records, and reading about myself for the first time broke my heart. The notes revealed a very shy, odd, withdrawn, sickly little girl. And what broke my heart the most is that I became mute. I stopped talking. And I started to throw horrible tantrums. That was the start of my culturally imposed career as a patient. Judi talked about the spiritual imperative of staying true to oneself. My life journey is a heartbreaking example of the cost of denying one's truth. Well, it almost destroyed me multiple times. My medical condition ultimately would lead to me having over 18 surgeries and being hospitalized more times than I could even count. As I began an adolescent, this is when things really began to get bad. My hormonal variations magnified the differences between my typical peers and I. I never felt I belonged to either world, the boys or the girls. I finally found a way where I could find myself by dressing like the androgynous rock stars of the 80s. Adam Ant, Boy George, and Pete Burns of Dead or Alive, they saved my life. They gave me an outlet so that I could be myself. My closest friends even started calling me Aunt because they didn't know how else to describe it, and every day was Halloween. I struggled to follow the rules imposed by a culture that refused to acknowledge my reality, and they rejected my personality. They called me a nonconformist, but I was just a kid. I was not taken seriously. I hid in every band class, as first chair alto sax, and behind my piano where I composed award-winning compositions in my school. I also had explosions of creativity with my artwork where I also received many awards. But as I look back at that time, I realized that I did not have to hide at all. I was already invisible. All my health problems added to the drama. I was always sick or always injured. All my doctors were puzzled and they could not figure me out, so they threw me away to the psychiatrists. Psychiatrists tried to fix my problem with drugs. Unfortunately, these drugs made me much sicker, and ultimately I became disabled by the age of 18 years old. Sad to say, medical interventions brought me close to death on 3 different occasions. As my isolation escalated and my physical health declined, so did my mental reserve. My spirit started to die. The hopelessness and the despair I would feel was profound at times. I confronted this despair by self-destructive acts, like suicide attempts and cutting, because the world had taught me to hate myself. And somehow the cutting would release endorphins into my body and make me feel a little bit better. As my body changed in adolescence, I didn't feel at home in my body or to this world. I was in and out of psychiatric hospitals for months at a time, and in that process I was diagnosed many things that would later be proven not true. The one thing I did avoid was becoming a drug user. I didn't have to. My psychiatrist had become my drug dealer, and I was one of the best compliant patients, again, trying to be the good girl. I have known James since middle school, when I was Aunt, and at 21 years old, I reconnected with James. We immediately found love. He was my first love, who met me for who I was. He was the first to show me that my body was okay. We are no doubt star-crossed lovers. I tried very hard to conform to society. I actually at one time wanted to be female. I was painfully jealous of typical females, and this was partly due to my sister. And I went to great lengths to hide everything masculine about me, and sadly started taking testosterone blockers. For my doctor convinced me that this would be best, since the effects of my own testosterone were clearly producing characteristics of a man. Like promised, the testosterone blockers helped me to feminize my characteristics. By the time James and I would marry in 1995, I became a beautiful woman. Our wedding turnout was impressive. Everyone wanted to see Aunt in her wedding dress. By then, I had sadly lost myself. My truth shrunk further and further from me, but I had become the good wife. Yet, with hormones a shambles, there was no intimacy between James and I, and James had lost me, and he lost himself into drugs and alcohol. I then began became very busy trying to rescue him from his own self-destruction. It was during this time I became pregnant for the first time, and we lost that baby to miscarriage. Due to having great love for each other, we somehow endured all this loss, and James found his sobriety, and I somehow graduated college. It was the first of 4 miscarriages. It was then that doctors finally realized that I was hormonally a mess. Once again, doctors finally thought that they had all the answers, and with that wisdom came new evaluation with the psychiatric community that proved that I was not mentally ill. I then went through my own sobriety and getting off all the psychiatric poisons. With slightly a clearer picture of my physiology, doctors began to help conceive and keep our 2 biological babies. Female hormones finally allowed my body to successfully carry 2 babies to term, but there was one problem. My pelvis had never feminized. I have a very narrow male pelvis, and this meant that my babies had to be born C-section. My first got stuck and went into fetal distress, and my second actually fractured my pelvis when she dropped before I could even make it to my scheduled C-section date. It was an absolute nightmare. Due to having so many pregnancy complications, our family grew to completion with the adoption of our youngest daughter, and I became fully dedicated to fulfilling my job as supermom to a family with extraordinary medical, physical, and social complexities and challenges. You see, our 2 biological children share some of my mutations. Our one biological daughter was so sick that at one point she even had a Make-A-Wish trip. They told us that she was likely going to die. Facing physical devastation with 2 of us confined to electric wheelchairs, and with our service dog, we traveled the country. Because of the consequences of medicine mismanagement, I went into paralysis. That's why I was in an electric wheelchair. And my daughter had such profound problems with her body. There we were, the 2 of us, traveling to metabolism and mitochondrial disease experts to get answers. We underwent muscle biopsies, genetic testing, and slowly the mystery was unraveled. We finally discovered a dietary regimen that brought us back to health and helped our bodies to create energy better, and our wheelchairs became a thing of the past. We also learned what medicines to avoid, because some of them were mitochondrial toxic, and we avoid them at all costs. 2 of our discoveries would profoundly change our lives in every way imaginable. The first was that my body needed testosterone in order to thrive, and the second was that feminizing hormone supplementation had to be stopped. I was literally dying as a female, but this meant I would masculinize. This would profoundly change us socially, culturally, physically, interpersonally, spiritually, and legally. Everything would change. So with all this known, my life went full circle. This meant that I would appear male to the world. After reclaiming my truth as that little boy, I decided to go into full transition to male. During the last 9 months of my transition to male, I listened with care to some people whose lives now seemed divinely connected to mine. In listening to their truth, I found my truth. I listened to the stories from the well-known transgender people and intersex people in our world. As I listened, I could hear every one of their stories, and I worked to understand their truth. They helped me to heal my broken spirit, and I was no longer alone anymore. Like the quieting of a storm, the process of listening to these people speak connected with my lost soul. I could finally hear and connect with my own truth again. I am Mel. I'm a guy. And to describe myself further to this world, I am a man with intersex traits. I also identify as transgender, androgynous, non-binary, and gay. There are just labels just to describe what type of man I am, a way to describe myself to you. Most of all, I am an extraordinary, fortunate person whose wonderful body gifted me the capacity to carry babies to term and nourish them with my own body. So this makes me a proud seahorse dad. Because as some of you already know, the dads are the ones that give birth. So it is my hope that as I emerge a social activist, that I can show others who have almost died like I have that they can survive, that this world can change for us. And I want to personally thank each and every one of you out there in the audience for making this change possible today by doing one thing, just simply by listening to me and sharing my story. I'm no longer invisible, and I am a survivor.